As we know that snow melts from the edges and a lot of disruptive technologies, they also enter healthcare from the boundaries or outside. And for example, animations and gaming. So extended reality is one of those set of technologies which have entered into healthcare from outside. And as we know that in today's time, we are living in extended reality, which is through various personas that we have created on social medias, LinkedIn's and Facebook's. So extended reality is the reality today. And we also know that the reality is controlled by the subconscious mind. And what I perceive after looking at a painting is very different than what you would perceive. So reality is very subjective, and it's based on our own subconscious thinking and data that we have gathered throughout our life. So with that, we have a very accomplished guest today, Dr. Mark Zhang, who's at Brigham's and Women's Hospital. So welcome, Mark.
Thank you, Dr. Rana.
Yes. And we look forward to some exciting insights on the technologies that you're working on. And as a first question, the audience would like to know, like, what brought you to extended reality realm of things, especially in healthcare?
Of course. And first, let me just say it's a real pleasure and privilege to be on this stage. I was actually here back in November, right at the beginning of, very early into my journey into this field of extended reality, and specifically medical extended reality. And to give you a little bit of context, I kind of run and help lead a digital innovation group at Brigham and Women's Hospital. And as part of our kind of work, one of the things that we focus on is emerging technologies. And about a year and a half, 2 years ago, we were asked by our leadership to really think about how we can be more strategic about thinking about emerging technologies. And as we thought about what to look at first, XR was really having kind of the AI moment 2 years ago. So all the kind of excitement about AI, which is very real, and I think is going to fundamentally change a lot of what we do in healthcare. XR was kind of having the same thing about a couple of years ago. So as we started looking into it, both at Mass General Brigham, but also across the industry, my eyes kind of opened. I didn't come in as a subject matter expert. I came in as a very real novice. And as we looked at kind of the work happening both within Mass General Brigham, but also across the industry, the things that I realized was, number one, XR is a fundamental technology, I think just like AI, that will define 21st century medicine. Because what we're talking about here, when I think about the field of extended reality, it's really about how do you use immersion? How do you use digital assets within your physical space? And in medicine, there's just so many use cases already with the current state of the technology that could be potentially leveraged. And it's just exciting to think about how the future will kind of move forward given that.
Yeah, excellent. So could you please elaborate some of the use case scenarios that you've kind of worked at in your hospital or outside?
Yeah, of course. So, when we first looked into this, I was surprised actually, because I didn't really know much. And when we first did our initial diligence, we were looking both within Mass General Brigham, but also across the industry. And what was surprising was how much was already happening within our system. In fact, I learned about new kind of efforts and research projects and things going on within our system, like literally every week in the field of XR. And some of that was really just creating essentially a lighthouse for this, so that people kind of knew that we were doing this work. So when I think about kind of the use cases in medicine for extended reality, I kind of think about it in these like 4 big buckets. The first is simulation and education. So there's a lot of existing work, and it's probably the most, I would say, mature of the use cases and tools for extended reality. So creating kind of scenarios for patient-clinician encounters, or as a surgeon, being able to not have to go to kind of a high-tech, very expensive simulation center and getting much of what you need using kind of VR or XR technologies to simulate the procedures and steps of a surgery, or to plan a complex surgery by using kind of these technologies to be able to see CT scans inside of your world, or collaborate with others to see the same thing. You know, there are some Valhalla use cases that I think about that actually over the last week, a couple companies have recently raised, I think in combination, close to $250 million. And the use case is really layering CT images onto the body in a way where you give surgeons and clinicians kind of X-ray vision. And that's the power of this technology to fundamentally both change kind of our clinical world, but also I think just medicine as a whole, and hopefully affect quality. So that's like one big bucket, simulation education. The second bucket I think about is kind of therapeutics, diagnostics. They can be patient-facing, they can be clinician-facing. You know, there are these existing point solutions where XR is actually quite useful already. So what's fascinating about this is, as we looked into this, it kind of extends across the spectrum of medicine. You know, I'm a palliative care physician and a clinical informaticist. You're a trauma surgeon. You actually almost see the broad spectrum of medicine just on this stage now. We have like the art of medicine, which is probably more palliative care. And then you have the science, which is, and of course there's art in surgery as well. There's quite a bit, but it's a little, I would say, a little bit more kind of technical and procedural. And the use cases for XR span both. So for mental health and for palliative care and other kind of more art of medicine kind of fields, the power of kind of the social interactions you can have inside of an immersive space, the ability to use that sense of immersion to affect things like exposure therapy, or to even have a conversation with yourself using kind of two different avatars. Those are some pretty powerful kind of use cases. And then from the surgical standpoint, and kind of more of the therapeutic standpoint, there are tools and use cases where XR can be used to diagnose refract. So actually, I'm sorry, I was correct, diagnose, so refract. XR can also be used to treat kind of for rehab. It can be used for chronic rehab or cardiac rehab. So there are some pretty great use cases there as well. I think the third bucket that I think about when I think about use cases for XR in medicine is just kind of the administrative and general uses that kind of XR will enable in the future. So these are the kind of the things that groups like Meta and Apple, with their release with Vision Pro, are kind of purporting and touting as benefits for consumers today. You know, having the ability to have infinite screens, or have the ability to communicate with people who could be in all different parts of the world, but be in one place in a virtual space. Those things will also benefit healthcare as well, because I think at the end of the day, it's a fundamental shift in the technology that's going to be really exciting.
That's great. I'm particularly very excited about the surgical training, because I recall my days as a fellow and resident in Toronto, and you slog out like 24 hours and 36 hours kind of trauma call shifts in the hospital just to get that extra bit of skill, you know, under your belt. And simulation centers were good, but they didn't do the, you know, the holistic job, and the access was a problem. On time, and a lot of those issues were a big concern. But now I think I wish this was available for me as well at that time, because it was a tough training overall. But then how do you, it's a new technology, like for any new mission, you need to have a collective strength, or, you know, where you have regulator, you have payer, you have patient groups, and you have managers. So there are so many stakeholders in this complex ecosystem. So Do you have any associations or anything that you would like to share?
Yeah, of course. So I would say that I think the technology as a whole has been around for decades and decades and decades. But like many of these kind of emerging kind of technologies, they have these periods of interest, and then sometimes they go back into kind of hibernation and then come back. And as a clinical informaticist, especially focusing on digital innovation, people have asked me in the past, well, how do you think about what's the next thing? And in some ways, and maybe this is a little cynical, sometimes it's not that hard because we are traditionally healthcare a little bit more conservative. So we tend to be a little bit slower to adopt kind of emerging technologies, or frankly, even just the technologies that we use in our everyday lives. So in some ways, you can just kind of look back 5 to 10 years on the consumer side, see if we're doing it in medicine, and if we're not, we're probably on the way to trying to do that. And it's fascinating because about 10 years ago, 10 or so years ago was when DK1 was released, and that was really I would say the first kind of big push for this kind of big jump into a more affordable, consumer-focused kind of VR, XR kind of experience. So we're just right about on track, right? So now 10 years from that is what I think is another big surge in interest in the medicine side, but it's still early, and what we're trying to build both at Mass General Brigham, but also with this larger society called the American Medical Extended Reality Association, is some of those foundational pieces to help kind of ensure, I hope, that this time, when that interest kind of climbs and continues to climb, it doesn't go back into a hibernation, that we kind of move forward, because I think now is the time. And I'll just be clear, this is being built on the shoulders of a lot of pioneers. We're not the first group to exist in this space. We certainly, I hope, we're not the last. But what we're trying to build at the American Medical Extended Reality Association is a nonprofit, interprofessional, interdisciplinary medical society to truly support this fundamental technology that, again, I think is going to be hugely impactful to medicine in the 21st century. We have been around for about 10 and a half months. So I kind of announced AMXRA in November here when we were very early. I think we only had, probably a couple dozen members at the time. Well, now we're up to 230 plus. And we're actually closing out our founding members at 250. And then we'll just have a general membership. But really, we're physicians, nurses, scientists, technologists, entrepreneurs who are all focused on a singular mission of advancing the science and application of extended reality. And we're starting from ground zero. So we have 3 core initiatives at AMXRA. The first is we truly want to be the medical society for this field. So we're trying to provide all the things that a society would give. So a place to break down silos, a place to communicate with other colleagues, hopefully in the future, recognition for leaders in the space that really contribute and move the field forward. And I hope also educational kind of opportunities for people who are just learning about the field of extended reality in medicine. The second core initiative is education. So, we're educating our public about the benefits of XR for healthcare and that it's a tool within our tool belt. We're educating our professional societies. So working with groups across the spectrum to talk about kind of XR and how it's, again, going to be, I think, a fundamental piece of the puzzle of the 21st century healthcare. And also, we're beginning to work with our regulators and helping to comment on some of the, hopefully, fundamental papers that help regulate this field. The third thing, and I'm truly excited about this, and I think it's one of the reasons why you need to have a medical society to really move this forward, and why one of our fundamental pieces of the mission of AMXRA is to support the science, is you have to support the science. So right now, one of the issues I think with XR that we're trying to address is that even though since the 1980s, the interest and the mentions about virtual reality and immersive technology in healthcare have just kind of continued to rise and rise to now over the last couple of years, you have thousands of mentions of VR and XR and PubMed and other kind of research databases. There isn't a primary medical journal for extended reality. It just doesn't exist. There are journals for virtual reality. There are journals for serious games and journals for kind of proxies. But a lot of times what people do is they publish inside of their subspecialty journals. So, for trauma surgeon, they'll publish inside whatever the premier trauma journal is. Or for palliative care, they'll publish in Journal of Palliative Medicine. I think you need to have a journal for medical extended reality. And that's actually what we're doing at AMXRA. And I'm really pleased that we are very close to announcing publicly our partnership with a major publisher to make that happen. So I suspect that our journal will be live. We have an editor-in-chief identified, and I think we'll be ready to take submissions, I hope, within the next month or so.
Excellent.
So, yeah.
So do you get much support from the big techs as such in your mission? Like, do we see a conference or a summit sponsored by Apple's and Meta and Samsung maybe?
I think part of the reason why we created AMXRA is to truly have a nonprofit kind of independent voice of the clinician and the research community and just a non-industry sponsored organization. So, right now, AMXRA is a member-sponsored, member-based kind of organization. Certainly some of our members come, and some of them are senior leaders in some of the major companies within the space. And just like any medical society, when we do hold a symposium or partner with another group to hold a symposium, I think there will be a place for industry, and we welcome that. You have to have all people inside of the space to kind of move it forward. But importantly, we're not sponsored by industry. Yeah. I think that's key, is that we are an independent organization.
Sure, that's kind of a global phenomena in a way, that most of the medical-led organizations are not the multi-sided platforms that you see as such, but maybe I think in future things will change with more trust on both sides, I guess.
And to be clear, I think this type of field, I think that the 21st century is, if the 20th century was defined by these incredible leaps in the science of healthcare, I think that the 21st century, we're still going to see that. This science is going to continue to leap, but it's going to be because of the technology. And the technology is going to play this huge role, as we're seeing with AI, as we're seeing, I think, with XR. And I think there will be other kind of foundational changes. And I like to sometimes say that if you think about where we are today, it's the 21st century's 1923. And imagine where medicine was in 1923 to today. That's where we're at. And if you think about that, think about just kind of how medicine it's not going to be static. It's going to change. And what we're building with AMXRA is, I think, and I hope, a pillar organization for that 21st century of medicine.
Absolutely. So with that, I think we have run out of time, but it's very engaging. And I would say that whether we believe it or not, but our future generations would live in a reality or a hyper reality or reality plus kind of world. And it's up to us to harness the goodness out of it from the technology and use it in the healthcare and wellness space. So with that, thanks for your time and great insights. So thank you so much.
Of course. Thank you all.